So the talk today is about different aspects of breathing and how it affects our body. And I try to include a lot of information in the talk. So because I included a lot, it doesn't go much in depth. So if you have a question that I touched on but didn't quite elaborate, we may be able to have time to go more into depth on this if we have the time. And yeah, so if you have something in mind that you want to ask now before we get started, you're welcome to do that.
I was going to ask Janna, what's the cue for breathing from your diaphragm again? What's the thought, the muscle thought that we should be putting in? You know, because I don't want to end up or just poking my tummy out. What's the? So
I don't know there are analogies that can be used with diaphragmatic breathing. And I'm happy to answer this now because it's not in my presentation. So when I work with clients and we work with breathing, when I lay them supine, so just lay them on their back, pressing down on their shoulders actually helps to open up the rib cage at the bottom, which usually frees up the diaphragm. So that's one thing. And another one is putting an object or just putting a hand on the diaphragm at the front, so just a bit between the rib cage, sort of just where the rib cage meets at the front, and that little, there's like a little dip. If you're laying down, you'll feel it really well, and you'll feel that rising and falling. That's one way of really feeling the diaphragmatic movement. And another way, which I believe is more effective, is actually feeling like kind of giving yourself a hug and feeling the sides of the rib cage. And if you're breathing in and the sides of your rib cage are moving outwards this way, then then the diaphragm is descending. But sometimes just putting a hand on the abdomen and feeling the abdomen raising and falling, that's not necessarily indicative of the diaphragm that's moving well. Sometimes the abdominal muscles are used when they really shouldn't be used. So when you're laying down, it's actually a bit easier to isolate. And I have the feedback from quite a few people that pressing down, just, you know, when we tend to have this posture, sitting down with shoulders rolled forward and slouching, it makes the whole posture worse and it compresses the diaphragm. So when we're laying down, we're already automatically improving that, and we're using gravity to counteract the shoulder movement and the thoracic movement. If you extend the shoulders back, kind of roll them back, or get someone to press down on your shoulders, your diaphragm will be a lot more free.
Thank you. Thank you.
You're welcome, Jenny. So the name of this talk is The Lost Art of Breathing, as you know. And today's all about breathing. So I talk less about myofunctional therapy and tongue movement and so forth, and more about breathing. Just to let you know, the previous talk that I did within this series of talks that our wonderful management has organized was called Tonsils, Adenoids and Wisdom Teeth, Spare Parts or Not. And that's been recorded and I think is available by request from the reception. And next talk, we'll talk about the magic powers of the tongue for sleep and growth. And that's on the 9th of December. Right, so I would like to start by sharing who are the people that I learned from. And a few of you know that one of an important parts of my work is using Buteyko method. Jenny knows it very well, experienced firsthand. And I learned from a teacher in the Russian language, which is where the method comes from, who learned directly from Professor Buteyko. So I was quite privileged to learn in the original language and secondhand rather than third or fourth. So I started studying the Buteyko method in 2010, but I became certified in 2016. And another teacher who I give a lot of credit to is Dr. Rosalba Courtney, who has a PhD in breathing physiology. And she is an osteopath by training. So her perspective on breathing is, I would say, it's more comprehensive because it takes into account more aspects of breathing. Just to give you a brief overview, so Buteyko method was developed to help people with chronically low CO2 levels or hypocapnia. And that happens in a lot of asthma, allergic rhinitis, and people with chronic nasal congestion conditions. This method focused on a 24/7 breathing normalization rather than a particular breathing exercise as such. There's lots of breathing techniques, and most of them are a specific exercise to achieve a certain outcome, whereas Buteyko method isn't quite that. It also helps for people with snoring and sleep apnea. However, that's not the whole story with snoring and sleep apnea, and I can go into that later. And the image here is kind of just a brief overview of the depth that Buteyko method gives in terms of the biochemistry of breathing and essentially transporting oxygen to the cells, and the key role of CO2 in making sure that oxygen is released to the cells. And we all want oxygen for our brain and our cells. The integrative breathing method includes the biochemistry of breathing. So that's the oxygen and carbon dioxide balance, gas exchange, nitric oxide, and all of this. Biomechanics, so that's the movement of a diaphragm, whole body movement during breathing, and so on. And psychophysiological aspects of breathing, so it's heart rate variability, the effects of stress, lifestyle, and so forth. So what is functional breathing versus dysfunctional breathing? Dysfunctional breathing is called that because it doesn't fulfill its functions. So biomechanically, there is an action of respiratory pump, which helps with lymph and blood circulation. Biochemically, again, is the exchange of oxygen and CO2 and regulation of blood pH. Psychophysiological and self-regulation, that's more related to the nervous system. Another function of breathing, which is more secondary, is speech and vocalization. So how we speak will be affected by our breathing. Homeostatic rhythms, fluid dynamics, and also spinal stability, posture, and motor control. So secondarily, breathing is related to a lot of other systems. So what is functional breathing? And that's just one of the definitions. It's not the ultimate truth, but I think it's fairly comprehensive. So functional breathing is efficient, and that means that the rate, the depth, the muscle movement or recruitment, and the regularity of breathing changes according to the context. So that means when you are running and when you're sleeping, your breathing will actually be quite different, but it's efficient according to what you're doing. Adaptive and appropriate to environmental conditions. So when you're in different environmental environments, cold, hot, when you're fighting off infection, your breathing will change. When you sleep, when you're awake, activity level, so you're sitting down or you're swimming underwater, and metabolic need, so to do with digestion. That will also change our breathing, and the breathing should adapt to what our needs are. The functional breathing is also responsive. So breathing responds to other body systems and their nervous system, digestive system, muscular and skeletal, and cardiovascular. And at the same time, breathing supports those other body functions. So dysfunctional breathing will produce symptoms, and when we can regulate biomechanical, and psychophysiological dimensions, we will improve the functionality and reduce symptoms. Does it make sense so far? Yeah. Okay. So normal breathing parameters, and there can be many. But if we were to sort of, these parameters were developed by Rosalba Courtney, and I believe that they reflect, because we breathe 24/7 and we do different things, they reflect our breathing in different conditions. So breathing should be effortless, and it should be inaudible, so you shouldn't hear it. If you're experiencing breathlessness or respiratory discomfort, that's not normal. Breathing rate can vary a lot from individual to individual, but if the breathing rate is under 16 breaths per minute at rest, that's not very alarming. Tidal volume less than 600 ml. The breathing is regular, even, and rhythmic. The breathing is nasal, so through the nose, and exhalation is slightly longer than the inhalation. End tidal CO2, which I will talk a little bit about this, how we measure the end tidal CO2, is between 35 and 44. Again, depending on what is done at that particular point in time. I like to always say when we practice in the office that it's between 38 and 42, and medical textbooks tell us that it's 40. So +2, -2. Blood oxygen saturation 95% or higher, and breathing is diaphragmatic or abdominal depending on what activity we're doing. So a lot of the times people come to see me because there's something to do with breathing at nighttime, and that's why I put this in. So breathing pattern at nighttime, ideally you want no sound, lips together, and if there is any sound that you can hear, it's a sign of some kind of dysfunction or a compromised airway. I will play this, it's a video, and I know I have some background noise, so I don't know if you can hear this, but there is no noise. The child is sleeping with lips together, and we don't see chest or shoulder movements. Okay, can I ask you one question? I know I have crickets going on the background. Are they very noisy? No? I'll just go and close the window just so it's quieter. Sorry, the window is closed. Crickets are very loud. Okay, so biochemistry of breathing. I'm not going to go in a lot of detail into this, but just a few key aspects that I want to talk about is oxygen hemoglobin dissociation. So when we inhale the air and the oxygen goes into our lungs, then into our bloodstream, it gets transported by hemoglobin to the cells and the tissues. And the CO2 is the gas that helps to unbind oxygen from hemoglobin so that oxygen can be used by our cells and our tissue. This graph here shows that there needs to be a certain concentration of CO2, and the medical textbook tells us that it's 40 millimeters of mercury pressure in order for oxygen to be available to the cells. And that's a chemical component of breathing. The role of CO2 in breathing, I don't want to go in a lot of detail about this, but I just want to draw your attention. There was a recent study in Korea that was done on young people, and that's quite rare. I was interested in this study because usually the studies are done on people that are either have chronic illnesses or are older, but this was a study on young people. And they discussed a condition called symptomatic hyperventilation, which is what happens during hyperventilation is an excessive loss of CO2. And they saw that there was a wide range of symptoms that these young Korean people experienced, including respiratory or cardiovascular diseases, mental health type of disorders, breathlessness, dyspnea, anxiety, and so on. And when they help them to normalize, to reduce hyperventilation, normalize their breathing, they had an improvement in physical and mental health related quality of life, and they measured that in that study. So CO2 is important, as well as the oxygen, as well as the hemoglobin, in the way that our body uses up the oxygen. How we measure the CO2 in the office is I use a tool that's called a capnometry, and it's not a machine that does something, it's just a monitor. So the advantage of this machine is that monitor is that it gives us an immediate biofeedback. So the patient's able to see when they alter their breathing in any way, or they relax, or they do a meditation, or they do this or that, what happens to their CO2. And that's very useful. We can also measure the corresponding blood oxygen saturation using pulse oximetry if we want to. The monitor shows us the breathing rate and rhythm, which are parameters that are useful to work with. But obviously that's not everything. I find this a helpful tool in my work, and it's very useful to actually being able to see what your breathing looks like on the monitor. Now to the biomechanics, and again, I don't want to spend a lot of time on this theoretically, but basically we have a muscle underneath our lungs that's called a diaphragm, and during an inhale, diaphragm goes down. During an exhale, diaphragm relaxes and it moves up. So a neutral position for our diaphragm is up during the exhale. Therefore, when I work with clients and they're breathing, we always talk about the exhale happening by relaxation rather than someone pushing the air out. And this way, we're able to extend the exhale rather than extend the exhale on its own rather than altering it using other methods such as counted breathing. When the diaphragm goes down, the rib cage goes out. It's not a big movement, but it can be felt. If on the inhale, instead of the diaphragm going out, the diaphragm going down, the diaphragm goes up. That's called a paradoxical pattern of breathing, and it can be changed, it can be retrained. So when you see this happening, you will also see shoulders and chest rising. So if you see someone breathing like this, you will know that their diaphragm is doing something that's quite the reverse from what it should be doing. And interestingly, there is a corresponding cranial movement and systemic body movement and pumping action that happens when we breathe in and out. So it's not just the diaphragm. There are a lot of structures in the body that move at the same time with that rhythm of breathing, and it helps with lymph and blood circulation. So breathing is quite amazing, and we can't really live without it, so that helps. Right. Psychophysiological aspects of breathing is obviously, most of us know that our emotions affect how we breathe, and chronic stress or certain life experience, trauma, do have an effect on breathing. These aspects can also influence heart rate variability, vagal tone, sense of control, and it's mostly known that methods such as meditation, conscious breathing techniques, yoga, trauma release can be helpful in dealing with this particular aspect of breathing. But usually, if someone has a dysfunctional breathing pattern, it'll be a combination of psychophysiological, biochemical, and biomechanical factors. I hope this hasn't been too technical so far, but I think we're through the most technical part. A lot of the time when people come and see me, it's about mouth breathing. So what is mouth breathing versus nose breathing? Why do we want to breathe through our nose? So noses were made for breathing. Mouth is made for eating and speaking, in simple terms. Now, our nose has a very intricate structure on the inside, which helps slow down the air intake, regulate the volume of air that we take in. It regulates the temperature, it regulates the humidity, it helps remove pathogens, and it's a filtration mechanism. So it's quite amazing. I've put the profile of the mouth breather here, although it's not part of this talk because it was more sort of covered in the first one. But it's just here to say, not only it affects how we feel, but as a child, it affects how we grow and how our whole face and head develops. So what's so bad about mouth breathing? Occasional mouth breathing can be appropriate as part of our breathing as an adaptive system. However, mouth breathing that's chronic has an effect of reduced working memory and learning difficulties. And we can see this with school children a lot. So the cognitive system that's responsible for temporary storage and processing of information during complex tasks get compromised if we mouth breathe. And decline in working memory impacts on children's reading comprehension, math skills, academic achievement, and so on. Mouth breathing during sleep is also a problem. Why is it so? Firstly, when we mouth breathe, we have a more reduced upper airway muscle tone. The distance between the hard palate and the hyoid bone is lengthened, so that it becomes out of balance. The airway is more prone to collapse. Breathing control is less stable. Increased arousal, which can or sometimes is related with bedwetting in children. Snoring, upper airway resistance, sleep apnea, reduced blood oxygen saturation, inflammation are just some of the things of why we shouldn't be breathing through the mouth at nighttime. Some studies link bedwetting to mouth breathing. So 71%, there was a study, the reference to which is here at the end, 71% of bedwetting children are mouth breathers. And there was a statistically significant association between nighttime bedwetting and mouth breathing. Mouth breathing ear problems. 20% of incidents of the ear infection was said to be caused by mouth breathing. And in the more recent studies, breathing retraining reduced the infections happening in the middle ear. Again, those incidences are usually worse when the palate is high, so the roof of the mouth is high. That causes that, I don't know if you can see my cursor, so that causes this tube here to be more flat. When it's more flat, it drains, it doesn't drain as well. Okay. So nasal breathing is not just the nose. The nose is connected to the mouth, is connected to the lungs, and it's one big system. So nose breathing helps us improve lung health. Because mouth breathing leads to decreased lung function and increases the sense of breathing difficulty. You can see here in the picture what the bronchioli looks like in asthmatics. And I'm not going to go into why in this talk, just because it's going to take too much time. But a lot of asthmatics have benefited from learning to nasal breathe and regulate their breathing properly. And the protective effect of nasal breathing, particularly during exercise, was proven in this study here in 2008. So again, it's not just the nose. The nose is connected to the lung health, and if the nose is not used for breathing, there is increased nasal inflammation. Increased nasal inflammation leads to increase in inflammatory markers in the lungs, and that was also studied. I don't have the link to the study here. Nasal breathing reduces viral infection, and if you wanted to look into that study, the name of it is Prevalence of Upper Respiratory Tract Infection in Habitual Snoring and Mouth Breathing Children. And as I said, nose is the first line of defense against pathogens, allergens, and pollutants. So we want to filter them in the nose, and nose has different mechanism of doing that. Is the actual structure of the nose, as well as the chemistry that happens inside a nose due to nitric oxide gas, which some of you might have heard about. Another thing that's unfavorable about mouth breathing is that it proliferates that bacterial biofilm and microbiome that's leading to inflammation. And this is also linked to tonsils and adenoid enlargement. Well, we talked about tonsils and adenoids in the last talk, but I'll just run through this again. So they are lymphoid tissue at the back of the throat and the back of the nose, behind the soft palate, the adenoids. And their job is to produce antibodies and white blood cells, which help fight infections. And it's more common for them to be enlarged when the children are younger. And when they become large enough, they can cause the breathing to be noisy at nighttime with snoring or even sleep apnea. So what sleep apnea, some of the symptoms are snoring, gasping, or snorting, and pauses in breathing at nighttime, followed by a noisy inspiration at the end. Breathing through the mouth can be a symptom of obstructive sleep apnea, restless sleep, or sleeping in unusual positions, such as the head tipped very far back in an attempt to open the airway. Nighttime sweating, bedwetting, trouble waking up in the morning, sleepiness and irritability in the daytime, headaches in the morning, and hyperactivity and trouble paying attention and learning problems. So I don't want to go much into this, but there are studies that say ADHD is actually a breathing problem. It's not a brain problem that needs to be treated with medication. And I would like for us to do an activity together, a practice together, because people usually want to take away something, a practice. And for this, I would like you guys to turn on your microphones, because if it's only me doing this, this is going to be very odd, because I'm going to be making a sound if it's just me. I hope the sound will be recorded with others. It's going to be strange. Chantal?
Yes, we're ready. Sorry. Just said I'm ready.
Okay, you're ready to hum. Good. Can you tell me if the sound, like if everyone, the sound will be picked up from all participants, wouldn't it?
I believe so, yeah.
Okay, very good. No problem. Okay, so humming is a practice that was studied in scientific journals. You might be surprised to learn about this. And in one particular study, they studied how much certain breathing practices were able to raise nitric oxide. And nitric oxide is a gas that's produced in different parts of the body, but it's mostly produced inside the nose. And it has an antiviral, antibacterial effect, as well as a vasodilating effect, so opening up the nose and passages. And they found in this study that humming caused a 15-fold increase in nasal nitric oxide compared with just a quiet, relaxed exhalation, which did increase it as well, but it improved it a lot more. And there are other studies which look at humming and vagal tone, and there is a correlation that shows us that humming is beneficial for vagal tone. So I thought if we could all hum together and do this about 6 times, and we get into a nice relaxed space.
I'm just going to go ask the crickets to just stop their humming for a bit.
Oh yeah, crickets are not going to stop their humming, unfortunately, but they can join in.
Yeah.
So what we're going to do is take a breath through the nose and hum as long as we can on the exhale. After we've exhaled, we block the nose and push it up and hold for a bit. Then we let go and take a breath in again through the nose. Does anyone have a bit of a blocked nose today?
I do a little, but
Maybe. Just Chantal, yeah? Okay, you'll tell us what happens afterwards if you feel any difference.
okay.
Okay. So let's do this together. So taking a breath in. Hold on, I want to see a bit more of your faces. Okay. Taking a breath in. All right, I think maybe 3 times is enough. Nara's having too much fun laughing at us all.
I was laughing at myself, actually.
Were you? Okay. How did it feel? How did the humming feel?
Like I was a bee.
Like you were
A bee.
a bee, okay. Anything else rather than you being a bee?
Relaxing.
Did it feel relaxing? Yeah. Okay.
Yeah,
Did it? Was it relaxing for you, Brett?
Yeah, it was very calming.
Mm.
Yeah.
Yeah,
How-
I felt like I could hold my exhale out for longer. I normally struggle exhaling long, but I felt like I could control it a bit more.
Yeah,
I agree with Chantal.
Perhaps doing it 3 times wouldn't really make any difference to how your nose is feeling. You would need to repeat at least 6 times or more to feel a bit of that opening in the nose. Did you feel any difference just doing it 3 times or not?
Yeah, after the humming and then holding my nose, my ears would block up and I'd have to equalize them and then do it again. But it's a bit more open.
Yeah, but it would take more. Like it's not really enough. I just thought it was enough for us to get a gauge for what it feels like. And when you hum together with someone, like for those who have young children, humming together with them, you would be amazed how much it just calms them down. It calms the nervous system down. So it's quite an amazing practice for a few reasons. And someone who talked about humming as well as didgeridoo playing is an Indigenous musician whose name is here at the bottom of the slide. I don't want to pronounce it because I'll probably pronounce it incorrectly. But he talks about raising nitric oxide through humming and didgeridoo playing and singing. Okay, so I'll just put the info about the talks here again, and that brings me to the end. If you want to get in touch with me, the best way of doing that is either through the email or through my Facebook page, which is @FunBee_Practitioner. Or if you put in FunBee Functional and Breathing Education with Janna, you find the Facebook page and you can send a message for there. Or for those of you who know my phone number, you know, I'm just a phone call away. And the clinic phone number is there at the top. Time for questions.
Janna, in the children's class that I run on a Tuesday morning, I've been looking for sort of creative ideas. So the humming thing is really interesting. Are there any other potentially other sort of things I could try in regards to making the group sort of come together and relax and kind of work together?
I think humming with a large group of children, such as the setting where you are teaching, humming together would be amazing.
Huh.
Just doing it with them, you know, so they start to follow your tone, and doing it at least 6 times, you'll be quite impressed with what it does for them. If I think of other things, I will let you know, but that just comes to as quite an easy.
Brett and Janna, is Alicia.
Hi, Alicia.
If you were to create a room environment with a lot of mirrors, you can have the acoustic sound system. Because of the humming and it's closed room, usually we do humming at the end and in the beginning of a yoga class. And it's pretty powerful to settle the minds. And if you have mirrors or, you know, in an enclosed room, that would help with the sound effect. And, you can really feel it's like an energy, the rising energy. Just a thought.
Yeah, definitely. Definitely. Thanks for sharing this, Alicia.
Yes.
Are there any more questions in relation to anything in the presentation?
Janna, I had a question. Is there a I don't know if I missed it, but are there any causes or things that would lead someone, or especially a child, to have mouth breathing? So things that you can see before it begins, or certain, Is there
Yeah, definitely. Yes, definitely. So that I usually look at mouth breathing from 2 main perspectives. The third one being the trauma and neurological things, which is it's just not something that I work with, but I think it plays a big role. And the 2 others are either a narrowing or a congestion or an obstruction is somewhere in the nose or at the back of the throat. And if it's difficult, it's just quite simple. If it's difficult to breathe through the nose, someone will start breathing through their mouth. And what we do in this cases is we work with rehabilitating the nose. So it's like going to a physio after your leg has been in a cast. You know, if you've had a fracture, you need to start using the leg again. You need to learn how to use it again, to walk again. And this is similar if you've had a blocked nose. You need to learn to reuse it again. Get rid of inflammation in the nose and reduce the size of tonsils and adenoids with using the nose and getting rid of the biofilm and repopulating the positive bacteria to live in there. If that makes sense. So That's in relation to the nasal congestion. And there are other times when the nose is completely fine, and it's more so the oral tone, so the tone of the tongue and the lips that gets children walking around like this with an open mouth. And when you assess them clinically, they're actually fine, completely fine breathing through their nose. But they just they have a habitually open mouth posture. And when the air and then the mouth open posture starts leading to a blocked nose. If you just want to experiment with this, you know, try and put some cotton balls or something in your nose and walk around for a bit and then take them out. You will see that your nose has actually become quite blocked. And with children like that, we focus more on making sure that their lips are strong, their tongue is strong, and the muscles of the face around the teeth are working properly so that they can maintain closed lips and a correct tongue resting posture, which is something that I'll talk about more in the next talk. And sometimes people say, yes, it's a tongue tie. It's not always a tongue tie. A low muscular tone happens for other reasons as well. For example, with Down syndrome kids, not necessarily they have a tongue tie, they may, but that's, you know, that's not a correlation. Like they have a low tone and that leads to mouth breathing. And then in turn, that can lead to difficulty breathing through the nose.
Thank you.
Yeah, so improving, have I answered your question?
Yeah, so either through some sort of trauma, whether it's psychosomatic or, you know, nasal congestion, something like that, and it would build that habit within them to just up to
or oral tone. Habits like thumb sucking as well, you know, or they can influence the tone of the lips and the tongue. So yeah, there's a few factors, but it's just important to find them and eliminate the cause so that we, you know, our body can function the best that it can.
When I know, like I've noticed a few through my experience that there are sometimes infants, very young infants, who you can just hear that they're mouth breathing, but they're obviously quite young. Is that something that is just corrected over time, or it's not really, is there a cause for that, or is it just?
It's the causes are the same with infants, and as soon as the earlier it's addressed with infants, the better. So that's why my preference is that parents come to me with their infant rather than with their 2-year-old, 4-year-old, 6. I mean, as you know, I work a lot with 2, 4, and 6-year-olds, but I would actually prefer that to see a mum with a newborn, or, you know, a 6 months old who's already developed this habits, because they're easier to correct at that time rather than a bit later down the track. You know, when the habits appear, that's when they should be corrected.
Thank you.
Janna, I have a question. I have a little one who actually holds her breath almost every breath sometimes, and it began when we went through a stage where she was getting a lot of colds all the time and she couldn't breathe through her nose, so she would hold her breath to breathe through her mouth, if that makes sense. And she it's sort of become a habit.
Do you notice she takes the breath in and then holds?
Yes.
Yeah. And then she breathes out and then takes the next straight away, or she will hold after a breath out as well?
No, she breathes in and holds and then breathes out. Breathe in, hold, breathe out.
Yeah. Look, like you remember how in the beginning of the talk I said that breathing is adaptive. And so because breathing is so important, our body will find ways to compensate and help us in a sense. So if with the way that she's breathing, it disturbs her biochemistry enough, that breath holding probably helps her achieve some sort of balance. Not to say that it's normal, but it's so there's a competency and compensation. And that breath holding is a compensation, but it helps her get through her day, if that makes sense, because she's probably regulating the biochemical aspect.
Okay.
Does it answer your question?
I think so.
Yeah. So you ideally want to help her rehabilitate and breathe through her nose.
Yeah.
And as this corrects, you may notice that she has stopped doing that breath holding, rather than saying stop breath holding, because she's doing that for a reason. Her body has created this pattern for a reason, and it's helping her cope where she's at with this particular habit. Does it make sense?
Yeah. Okay. Thank you.
You're welcome. How are we going for time? I would like to finish at 7:30. So we have about 10 questions. We can finish early if there's no more questions, but let me know if you think of something else that you would like me to answer. Alicia, I'm interested in the work that you do with breathing, because I know that you do a lot of education with clients about their posture, and posture and breathing are so intricately connected. What's your perspective on guiding and educating your patients about breathing?
Usually I will explain to them. A lot of them think that good breathing is belly up and down. And therefore I explain to them, look, these are the rib cage and lungs are in the rib cage, and therefore when you breathe in, you should feel the rib cage start to expand out to the side. And like you say, when you see a lot of shoulders movement, it's not the right breathing. We do not want to recruit intercostal muscles when we breathe. We want to feel that we are using the lungs to breathe. And therefore, I always use the analogy of deep breathing. Look at who live the longest among all the animals? Turtles. They are slow and steady, and they breathe slow and steady. And some other animals like dogs, they pant. Those breathing, so they can, especially teaching children, they can feel, oh, okay, so that's the breathing. I was talking about breathing in the rehab session with 3 children this afternoon, and I was asking, so 1 minute, how many breaths should we breathe? And I actually demonstrate 1 breath. How long is it? They say 300 breaths per minute, and then the young child said 2 or 3 breaths per minute. Yeah, that is something that we want to work towards. And when I teach yoga, I also explain to students, the deep breathing, especially, like you say, a lot of psychological factors when we breathe. When students are in anxiety, they are perfectionists. They want to get a posture right. They look at themselves in front of the mirrors. They can't do the posture correct, and they stop breathing, and they keep working on the posture. Therefore, they are not getting the effective result of the posture. Yep. So breathing is absolutely so important that, like you say, it's the art that has been lost in a lot of people. And I really enjoy this talk.
Thank you. Can you share a little bit of what you do as a chiropractor working with the diaphragm, if there is tightness around those muscles? Like what is your protocol making sure the diaphragm is working correctly?
Yes, what I would do is I mobilize the rib cage. So I work in between the intercostal, work on the intercostal muscles by bringing my fingers in between the ribs, every ribs, in between the ribs, the interspace of the ribs, and also use the fingers to go deep into, when they breathe in, the rib cage start to expand. When they breathe out, I will go to one side of the rib cage and start to massage the diaphragm. And a lot of times the patients can feel straight away it's so tight on this side of the diaphragm or the other side of the diaphragm. And therefore, once we feel the tightness, we'll start to use slow breath as they breathe out. I start to work on the muscles a little bit deeper. I always try to explain to them, ultimately, our goal is to be able to dig my fingers inside. And, you know, that is good diaphragmatic, that's the flexibility that we're trying to create in the diaphragm.
And what's the reason for the tightness that the diaphragm builds over time?
Shallow breathing has not been used, you know, for a long time. Shallow breathing, a lot of breathing is just on the upper lobes of the lungs and never get to push the diaphragm down, as you know, that's when we do the deep breathing, the diaphragm get to push down. It has not been used as much as it should be. And I also
would you say posture as well would have an effect on the tightness creating over time?
Absolutely, big time.
Slouching?
That's the round the shoulders forward, like you mentioned. And that rounding of the shoulders is actually collapse the lungs and the heart even further. It actually disengage the lungs function. And that's the reason why we want to get the patients to really have the rounded shoulders to work on. And a lot of times, when they round forward, that's when the thoracic adjustment comes in very, very handy. Once we are able to fix the spine on the upper back, sometimes that usually start to bring the whole rib cage extension. And the other thing that I usually work on patients is around the hyoid. You know, that's the airway, a lot of tightness around the throat and the airway. So yeah, a lot of things happening around this area. So we work around the hyoid bones, the stylohyoid. Yeah.
Yeah, wonderful. Thank you for sharing this.
No worries.
Are there any more questions for me tonight?
Hi, Janna. Yes, thanks for your talk. Really great. Can you hear me?
Yes, Jane, we can hear you.
Excellent. Thanks. So I think what I got from tonight is the importance of breathing through the nose. And my question sort of around going into the oxygen, the chambers. And when I've been in there, I've gone through my nose, but then I found over time, my sinuses, they sort of blocked. So then I needed to breathe through my mouth, and it was then rotating between mouth and sinus as I was trying to clear it. Is that sort of a typical response, or could that be something happening for me? I'm asthmatic and I've had sinus issues before. Could that be on my end, or is that a normal reaction?
Right. I don't think I can answer your question appropriately just because I don't have a first-hand experience of the hyperbaric chambers, and I don't have enough understanding of how the chambers affects this part of the body. I think it would be more appropriate to ask Dr. Reza if you could answer this question. But basically, the chamber is a shortcut to help you get oxygen into your system fast. Ultimately, you want to help change your breathing so that you can breathe optimally all the time. Chamber gives you a boost, but you want to use your own reserves to the best capacity that you have. I'm not sure what exactly the reason for your prescription of the chambers. Whether is that for asthma?
It's part of it, yeah.
Part of
There's
it,
other
yeah.
reasons, yeah. But I'm hoping that could have an impact positively, yeah. I think so. Just focus on the nose breathing, though, in general.
I don't want to.
I can give you a little.
Yes, Reza, if you can help with this question about the way of breathing in the chamber, because I know they have a mask as well. So how do you advise patients to breathe in the chamber?
Thank you, Janna. That was a great talk.
Thank you.
Because the sinus is the cavities, and any cavity changes pressure when we're changing the atmospheric pressure, just like when you're diving. And so therefore, if there is an issue with the flow of the sinuses, then if there's any fluid accumulating there, as the pressure changes, there's a slight tightening and constriction of the cavities of the sinuses. That's why if people who have sinus congestion, they might get a frontal lobe headaches when they go into the chamber. And that's usually the reasons. Otherwise, if the sinuses was not an issue, oxygen would actually allow you to breathe a lot more clearly. That's one of the reasons why you're getting blocks in your nasal cavities, and is mostly due to a disturbance, mostly probably some accumulation of fluid inside the sinuses that is being affected. Now, hyperbaric is not designed to help you breathe. There's two different ways of oxygen is delivered through your tissues. One is through the red blood cells from the blood, and one is through, as a gas, it goes through absorption through the plasma. So therefore, when you're in the hyperbaric chamber, your oxygen actually, the breathing should not be different only time unless you have an issue with the pressure. But during the hyperbaric treatments, you bypass, there's no influence, positive influence of a hemoglobin or red blood cells carrying oxygen, because they only have a certain capacity. Under pressure, oxygen does not bypasses that, and it dissolves into the plasma, into your tissues, because it's a gas. So it allows your cells to be exposed to a large percentage of oxygen, up to 2,000%, depends on the pressure. And that oxygen allows your mitochondria to become effective in its productions of energy. So it's a cellular respiration, but it doesn't have necessarily the impact on your breathing, unless people who have lung issues or fibrosis or asbestosis or some other lung tissues, that they're not getting enough oxygen to the red blood cells, then they feel a lot better, because oxygen is being transported as a gas through the plasma. That's the best way I can explain.
Yeah, wonderful. Thank you both so much.
Hey, Jane, it's Alicia.
Hi.
Just a quick tip. If it's nasal blocking, if you have blocked nose before hyperbaric, there's one quick technique that I usually teach students is using your knuckles to block one nose and then breathing in through the other nose. Once you achieve the full inhalation, you block that nose and then use the other nose to exhale.
Mm-hmm.
And then the same nose, inhale all the way in for a count of probably from 6, 5, 4, 3, 2, 1, and then use the other nose to breathe out. So that's just unblocking the nasal cavity before you go to the chamber. That may be something that you'd like to help. And remember to bring some tissue with you.
Yes.
And then after a couple of breaths, you breathe in through the nose, both nose, and you will feel it much clearer. That's just something that I thought may be useful for you.
Thank you. Yes, very much. Take that on board. Thanks very much, everyone. Wonderful.
Thank you. Thank you, John.
Thanks for that addition, Alicia. I would just say, Jane, if you're an asthmatic, your breathing aren't optimal. So helping you breathe, learning how to breathe before you go into the chamber, I think is going to make that experience easier for you, so you don't have to resort to breathing compensations.